So I'm going to now do it again, but I'm going to do it on someone different. Let's beat somebody else up here. Susan, where are you? Do you mind? I really want to show you this, okay? You're going to be a bit, first of all, do you feel a little lighter?
Sure. Wait a second.
What do you have? Sports problem? Perfect. Jonathan, how do you feel?
I feel like my right lung, in my right lung.
Do you feel lighter?
Yeah.
Do you feel the lightness seriously?
Yeah, seriously.
So, folks, I just took an air compressor and helped him get air on his right side. Jonathan, stand on the floor for a while and feel the floor. Now, there's no wrong or right answer, Jonathan. Which floor are you feeling now more, right or left?
My right.
Okay.
Honestly.
And honestly, when you put your weight on the right side, breathe in, blow out. If I keep him on his right side, he will be gone. He will lose this. If you'd have said, Gail, to me, Ron, I feel my left side. I don't have to work so hard at my techniques. But he said, I feel my right side. So, Gail, I'm not done with that guy. He's got to get up and say, you know, Ron, I don't know what you did, but I feel lighter, and I'm way over on my left side. And I'm going, But if he says, I feel lighter, and I'm way over on my right side yet, I honestly feel I'm on my right side, I got to give him a reason to find the left hip, the left floor, the left side. So, Heather, I know Jonathan does not have enough trunk rotation yet to keep him neutral, although he did prove me wrong last night. Does that make sense? You see what I'm just going to ask questions because I'm a clinician thinking, I wonder what he feels. Let's do another lady, okay? Let's do this lady. Remember horizontal abduction? Remember internal rotation? This is internal rotation on Susan. This is internal rotation on Susan. This is apical expansion testing on Susan's right chest wall. Take a breath of air in. I'm going to hold you down, Susan. You don't have to worry about anything. Just try to breathe. A little stressful? Is it hard?
My life in stress.
Is it hard to breathe?
Somewhat.
Okay. As I hold you, do you get more annoyed with me?
No.
As I hold you, do you want more breath?
Mm-hmm. Yes.
That's what I'm looking for. Because see, I'm increasing her tension as I speak to her, Daryl. Can you tell?
Mm-hmm.
About 30 seconds from now, she will want to get away from me.
All she's getting is belly breathing.
That's all she's doing. Nothing else is going on. And if I go on the other side and I do the same thing, she takes a breath of air in, she blows out the air, and I hold this side down, Susan. Can the camera pick that up? Look at the chest wall move on this side.
It's better.
Susan, you have no problem with me over here, do you?
Mm-mm. Hang out.
This is Hangout City. This is why this arm, Susan, will not turn, and this arm will turn. We went over that the last day and a half. Everybody should feel comfortable with that right now. And I could go over other tests with you, Chris, but we don't have to do that anymore. You always do a left AIC technique first, manually. You don't just jump into superior T4 techniques. So I did not with him do a left AIC technique. I'm going to do that, Brianna, with her. I'm going to recheck her. And if she still has brachial chain issues after I did that ZOA technique, the problem is not her left diaphragm anymore. The problem is she can't get air into her right chest wall. The problem could be she may have a right lateral intercostal wall that's restrictive, or the problem she may have a left posterior mediastinum that can't fill up. Did you see that what I'm doing? It's one of those. We're going to keep moving. I'm going to do a left AIC technique on her. Do you mind if I go right onto your skin here? Will that be okay?
Yeah.
I will keep you covered up. Go to your left. I'm going to draw my arm, scoot over there, and I'm going to bring my hand up to right there, Susan. Probably again, T12. She's going to take a nice breath of air in. We went over this technique, so I'm not going to go over it again. She blows out the air. And we both know, Susan and I know right now, that's not easy. I'm pushing here hard. Breathe in. And I cannot pull my right arm back like I did with Jonathan. So she takes another breath in. She blows out. And I am guiding down pretty good, Susan, am I not? Pause. Breathe in. Susan, I cannot get air into your right chest. Did you feel that, Susan? You are locked.
Yeah.
I can't get it. Deep breath in. Can't get it. I have to let up my left arm, or else I could hurt her. I can't get that right chest to move up. She blows out the air. Breathe in for me. We'll try again. Rotated her. Pause. Breathe in. Isn't happening. I could bring a second person in here and they could take the arm. I could bring a second person and work on some infraclavicular work just to get something going. But I'm not going to do anything but leave my hand exactly where it was and continue with what technique next? The superior T4. But I got to take my hand off to show you, Jacob, she still can't internally rotate. So I'm going to take my hand off momentarily. She still can't internally rotate. But I wouldn't really need to check that because I already know she cannot internally rotate. Horizontally abduct, etc., 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 etc. Because I didn't feel the right side open up. So I'm going to give you your hand back. And I'm going to do a superior T4 technique. And I am going to use a damn towel on you, okay? Your skin is so smooth. Okay. Thumb, off breast, but on sternum. 3 fingers to the left. This is what you're going to do immediately when I get done. Underneath her clothing, I have my right hand on her thorax. My thumb over here is parallel with her collarbone. And on Jonathan, you understand that this index finger and my thumb are in line with each other, while this thumb and this finger are parallel. Stay off nipple. Okay, man or woman. I come over here. She takes a breath of air in. She blows out the air. All right, Susan. Now we got something. Thank you. Now we got something going on. Left side went down. Pause. Breathe in. Blow out. Good. Susan, you feeling that pull?
Yes.
Breathe in. Susan just treated herself. I didn't treat her. Jonathan, who just treated her right there?
She did.
What muscle just treated Susan? Which side? Ah, you only be wrong once. The left side. Take a breath in again. Blow out the air. Thanks for coming, Jonathan. I appreciate it. Right there, she just dropped into ZOA. Did you feel that, Susan?
Yes, it feels great.
Now breathe in. Breathe in. Treat herself again. Blow out the air. Drop it, drop it, drop it, drop it. Thank you, Susan. Susan, you did it. Breathe in. Drop it, drop it, drop it. Let it go, let it go, let it go, let it go. There's another one. I'm still doing it with her. Breathe in. Is there any doubt she's going to have internal rotation? Because that was an apical expansion test. I kept my hand on her left side of her sternum, and she's no longer just belly breathing. What's going on, Heather? She's breathing here. Watch her. Blow out. Watch. Breathe in. Let's see what she's got.
Magic.
Superior T4. Any questions?
So you wouldn't do the sternal maneuver first? Or?
I did. I was kind of doing it.
Okay.
He did the
So
left
just
AIC.
because you're doing that, you're kind of doing both at the same
I
time?
did. I did the left AIC technique carry.
Yeah.
And then as she was breathing, I can't take my hand away because we were kind of having a little moment there.
You can either choose the sternal or the left AIC.
Yeah,
They're going to
yeah.
do
They're both ZOA.
Yeah. But she was doing so good, I just wanted her to do it. She was treating herself. I was just kind of having fun at that point, right, Susan? Come on, get it, do it.
Sure.
Do it, do it, do it. Keep going, do it, do it, do it. Does that make sense? Superior T4 technique. We are going to give you 20 minutes on this, okay? Hit a mat. Let's go right to it. We'll walk around. You got some expertise in the room. Use this, okay? Superior T4 technique. This table is open. This could be under this.
Okay.
But since we're teaching, we're going to leave you over it because I'm going to watch you. But technically speaking, this also could be under that bra strap.
Right.
You always get the permission of the patient to do this,
Right.
You get informed consent.
Right.
Now, since you knew what you were doing, let's start over again. You take a breath of air in, both of you. No, don't do anything. Just take a breath in. You blow. This is your blower. This is your exhaler. There. Gail, did you see how she just took your sternum on this left side and tilted it? Tilted it. Tilted it. Now you can let her breathe. Go ahead and breathe, Gail. Gail, go ahead and breathe. Gail, did you feel that? Did you feel how she tilted your sternum? Did you feel that, Gail? Now, we'll let her breathe again. Don't treat her. Just relax. Let up. Okay, so you did a good job. You got that. Gail, did you feel that? Did you feel that? On air in, this arm now is going to maintain its previous position.
Right.
And you're going to then take this arm and you're going to pull air in without going to her shoulder.
Okay.
So you're going to take this and help her get that air in, and you're going to increase the distance between those two hands. Okay. So here's where we're going to go. You take a breath and just relax. You're doing fine. Okay. If you breathe with her, you're going to be fine. Okay. So you both take a breath of air in. You blow. Don't worry about this right arm yet. There. You did great. Perfect. She has a zone. She's easy to work with. She's neutral. Hold her. Breathe in. Good. Now you're pulling versus that.
Okay.
There's that and there's that. You want to do that. You're trying to pull apart.
Okay.
But she's doing the work. You're guiding her. You're saying, Gail, I want air to come in here. Now remember, Gail's easy. You're going to have patients in here who are not this easy. They don't come in with bodies like this.
Right.
So you're going to take another breath in, and we'll let you do all this on your own. Ready? Blow out. Nice job. Just a little, can I show you this? Just a little more of that. Because you got to be going that way.
Right.
Hold. Breathe in. And blow. Hold. Breathe in. Oh, don't let up. Blow. Good. Good. And you always in on inhalation, so breathe in. Okay. Now I'm going to do it once to her. She's going to critique that.
Okay.
And then we're going to flip. I'm going to come over here. I'm going to do just what she did, and you're going to say, and be very honest with her if you think it's what you're feeling. Here we go. Take a breath in. Blow. And see, I'm bothered by this,
Yes.
but I'm going to stay there. She's so loose. Now, here's where, breathe in. There. Is that what you felt with the right arm? Here's what you felt with the right arm. You're doing this. I want you to do, breathe in, blow. You have this down. See how far down? Gail, did she go down far enough with you? Okay, now breathe in. What's the difference right there? Tell her.
You're firm here, and you're pulling here.
And my fingers aren't even doing the work. I'm just... Right, Gail? Does that make sense?
Yeah. Yeah.
You tell her when she's got it right, and then we'll flip, okay? Not that you had it wrong.
Yeah.
She's just saying, I was firm here. I was firm here.
You were firm on the
Exhalation hand.
and on the inhale is where I felt more firm.
Yeah, and then I held the exhalation
held it,
hand
yeah.
down, and then breathed in, and I kept it.